You're listening to OpportunitySC, where we shine a spotlight on the innovators, leaders, and advocates shaping the future of community economic development in South Carolina. We are so excited today to have as a guest on our podcast a true leader in system change and poverty alleviation in South Carolina. Donna Waits is the president and CEO of the Sisters of Charity Foundation of South Carolina. Donna, thank you so much for kicking things off with us today. Thank you for giving us some of your time. Just wanted to give you an opportunity to just talk a little bit about yourself and your journey into this work.
Well, thank you, Bernie. I'm so excited to be here with you. I appreciate knowing you, and I could throw every compliment you just gave me back to you. So, as you said, I'm the president of the Sisters of Charity Foundation of South Carolina. I have been with the foundation for 11 years, but I've been on a journey with the Sisters of Charity themselves for 26 years. So when you ask about the journey of my work and the evolution of work here at the Sisters of Charity Foundation, it actually started with the sisters, one of their ministries that they have here in South Carolina 26 years ago when I started as their first fund development coordinator, pretty fresh out of college, just trying to find my way, and found a wonderful spot here within this family of ministries and this mission that the sisters have created for us. I grew up in Gaffney, South Carolina, and so small town, a lot of rural areas in Cherokee County, and so being in a profession where we can really put an emphasis on the improvement of lives, especially rural counties, is something that I'm very excited to get to do every day.
That is such a wonderful story, and what's really powerful is that you're from South Carolina, you're from a rural community, you experienced the felt needs of people in the community, and you talked about this as a mission, as a journey, I dare say a ministry. Mm-hmm. Would you say that helps to give you the passion and the drive for this work?
Definitely. I will say that I knew early on that corporate life or corporate world or for-profit, society tells you that's what you're supposed to do, so I assumed that's what I would do. It didn't feel like a calling. And so when I was given the opportunity through a wing and a prayer, honestly, I still don't know how I got that first job with the sisters, other than that they saw something in me that I didn't see. But that connection early on with that particular program in particular, because the mission of Healthy Learners is to meet immediate health needs, basic health care for children that don't have insurance, or their insurance isn't enough to cover what they need, or maybe they have insurance and the parents just still can't get them to the medical appointments that they need to get to. I would have been that child had Cherokee County at the time, back in the dark ages when I grew up, had Healthy Learners. So I definitely felt a connection there to be able to use the skills and talents that God gave me to actually help people. All these years I've never been a frontline service provider. That's not the gift that God gave me. But being able to have an impact a few layers away has been, is why I'm excited to come to work every day. And I would say, too, the faith component of the work that we do, we're a Catholic organization. I'm not Catholic, but having the core values that the sisters gave us they do stem from Catholic values, but those were mine anyway. And so just knowing that every decision we make every grant that we make, all of the work that we do comes back to those core values. It's easy to say that you like your job.
For those who may not know who the foundation is, can you talk a little bit about the foundation, the sisters, and a little bit about those values that you mentioned?
Yeah, absolutely. The Sisters of Charity Foundation is actually celebrating 30 years this year. We were created in 1996 from the Sisters of Charity, who owned at the time Providence Hospital. So they came to South Carolina in 1938 to start the first Catholic hospital in South Carolina, which was Providence. And in the mid-90s, lots of hospitals at the time, for people who are listening or are familiar with health legacy foundations, were selling either all or a portion of their hospital to for-profit healthcare companies. And we, our sisters, sold 50% of Providence and a few of the other hospitals that they owned to this for-profit company, and they very courageously took the proceeds from that sale and created our foundation. So we began with $60-ish million from the sale of Providence, and that became our endowment. And so for 30 years, we have lived off of that endowment, where we are making grants to nonprofits throughout South Carolina. We're also sustaining our operations. And we've given away over $80 million in grants to thousands of organizations. The sisters started the foundation when they could have done anything, really, with that funding. They could have started a new hospital. They could have done other things, but their legacy is now cemented by that initial investment into our foundation. So they gave us the mission to reduce poverty. Their overall mission, the Sisters of Charity, is to extend the healing ministry of Jesus to all God's people. So our mission to reduce poverty is obviously very, very much in line with their core mission. They gave us the core values of courage, collaboration, respect, justice, and compassion. So our grant making, all of our strategy, all of the partnerships that we enter into and that we continue in, they must reflect those core values. Most nonprofits that know us do know us as a grant maker, but we've also been in the space of advocacy and leadership in other ways throughout our history. If you're not in the nonprofit space, most people don't know what I do. So I do love to get to tell the story of how we came to be and the great work that we get to do. Mm-hmm.
Providence could have focused just on Columbia and the Midlands, but they made an intentional decision to be statewide, to fund throughout the state, which you are really our only statewide philanthropic organization. We're so thankful to you. Those values mean for the time that we're in now.
That's a great question, because what should just be human decency and respect for human dignity, which are our core values, do seem a little bit radical these days. And you didn't ask this question, but I'll go ahead and touch on the fact that many peers in the philanthropic sector, many nonprofits over the past few years have faced tough decisions on how firmly they will stand and what their values were and are, for fear of lost funding or losing relationships that were important to keep their mission going. And I'll have people ask, how are you continuing to say some of the words you're saying? How are you continuing to be able to lean into your values loudly? And I will admit that one of my first phone calls a couple of years ago was to Sister Judith Ann and say, give me your advice, give me direction. I respect and appreciate and value the values, but if you want us to, soften things, or we'll take your direction. Ultimately, what we care about is people experiencing poverty. And she and the leaders among the Sisters of Charity said, absolutely not. These should not be controversial. They're not. They're the values that Jesus gave us, and so we are able, thankfully, to be able to live into them. Money. We aren't asking for funding from government entities where you might have to be a little bit more careful. Sorry, I took us right into
No,
the.
you're right on spot, on point, because that courage, I think, is needed more now than ever. And that intentionality is needed now more than ever because it's basic humanity and how we should be engaging with each other. How is poverty reflected in South Carolina? I mean, is it a one-off situation, or are there other things that are impacting poverty in South Carolina?
We did some intensive studies, research studies on poverty a couple of years ago. We did a study in 2020 that gave us quite a bit of data and actual numbers and facts related to, and it was very clear that there were structures in place that were the why, and the how and what keeps people in poverty. And that was all factual, that was all data, that was all quantitative research. And then a couple of years ago, we said, let's go back to the table. I think that data needs to be updated every few years. And this time around, we did a qualitative research study where we partnered with research teams to literally talk to people who identify as experiencing poverty and people who are serving those people who are experiencing poverty. And it's from their stories. That's how we see poverty now. So we come to our conclusions of poverty in South Carolina through the research that we have done. And the conclusions were, of course, were scientific, but I think overall what we learned is no amount of grant funding will get us out of poverty. No amount of grant funding from any one entity will change the ecosystem that exists and the systems that were created for a reason and have caused prosperity for some and poverty for others.
Right. Well, you mentioned data, and so there was quantitative data that was gathered. And I can remember a quote, we measure what we value. Well, we value the fact that we need to know about poverty. So data collection is important. On top of data, we have interviews, we have people with lived experiences. So talk a little bit about the importance of both, the data and the lived experience or the interviews.
From our perspective, again, going back to just the human dignity, the humanity, and the numbers on the paper aren't going to change people's hearts and minds. It's when you can feel something, when you can put yourself in the shoes of someone who's going through something that we think can be impactful to decision makers, to the change makers in our state, that these numbers that came out in 2020, they didn't surprise us, and they wouldn't surprise you, and they probably didn't surprise any lawmaker that took the time to go through it. But if you can hear hear in the voices of people who are behind those numbers, the hope is that you would see it differently, that you would feel it differently, and that would impact your decisions that you have the power to make. Just hoping for a little bit of empathy and the raw truth of thousands and thousands of people who live in our state.
Right.
That unless you are living it, have the lived experience, or you're in an ecosystem that You're faced with it every day. It's not top of mind.
Right.
So if we could be the gnat that brings the information to light, as much as people will listen, that's the hope.
Well, and you also mentioned earlier that there are other elements that affect poverty, and the powerful words you used was and keep people in poverty. I think those are called systems. In order to address poverty, you have to change systems, right? Can you talk a little bit about systems change work, because it's more than acknowledging poverty. It's looking at the root cause of poverty.
And I will give great credit to our founders, and to the original president of the foundation, who in the very beginning said we need to address the root causes of poverty. But as happens sometimes, the immediate needs of people who are struggling, they rise to the top. And so for many years, that was a major priority for us. But in our most recent strategic plan, and actually in our one before that, our board members that have been alongside us for a really long time and held the mirror up and said, what are we doing to actually make change happen? Why is the needle not moving? So we as a staff accepted that challenge, and we doubled down on it in the strategic plan. And the answer to your question is, what is the why behind whatever it is that a community, a family, or an individual is struggling with? If they don't have enough food, why? If people are struggling to break through to earn a higher wage, why? And the answer that we see lies more so in the systems that we inherited. So we are constantly reminding ourselves and our stakeholders and our partners that if someone is experiencing poverty, it's not a moral failing. Yes, we all have free will. Yes, we all have decisions that we can make, and we make choices. But going back to what we heard in the study is, you can just hear and see, if you're born in a certain zip code, you're born of a certain race or gender, the barriers that you just come into this world facing were there long before you were born. We're learning a lot. And I don't want anyone who's listening to this or seeing this to think that we have any answers. All we know is that long term, we have to pay attention to it. We have to invite voices to the table. We have to lift up the voices of community members who know the solutions. But what can we do as a funder and as a partner of organizations like SCACED to make it easier for those voices to be heard, in order to look at the policies? There's a lot of local policies that are in place, that have been in place for a really long time, that just a few shifts here or there. There's little things and little wins that can happen just with working together and getting people to listen.
Yeah. And systems change, that's pretty big work. And it's going to take more than one organization to move it forward. So that gets to partnerships and collaboration. First of all, thank you, Sister Charity, for acknowledging the need to address systems and the willingness to move forward in that direction. And I would assume you're inviting partners to join you in that journey. How do you think partnerships with nonprofits, CDC, CDFIs, other nonprofits can help move that work forward?
I don't think any change can happen if we don't have all of those that you just listed in the room together.
Okay.
Partnerships, you hear a lot about that. And to me as a funder, we always ask, who are your partners? That means more than you just make a referral every once in a while.
Mm-hmm.
But nonprofits, especially our grassroots nonprofits, our CDCs, our CDFIs, they're the ones who see the results of a system failing.
Mm-hmm. Mm-hmm.
So having funders, legislators, state agencies, local agencies, and our nonprofit community all at the table, to me, that is systems change. That is, we are a system. We are a part of keeping the society going. So the impact reaches beyond what an individual CDC or nonprofit or CDFI does. And of all the ones that I've met through SCACED, every single one of them believes that it's greater than just the service that they're providing to their community.
Mm-hmm.
They know that there's a certain limit to their capacity.
Mm-hmm.
So coming together to lean on each other's strengths, to ask, what did you learn in this particular situation that maybe could help me, and then combine the fact that no one organization is ever going to have enough funding or capacity to do it on their own, and they shouldn't.
Right.
We hope that through this new strategy, whether it be our funding or just our partnerships, that people will see that that power of working, even if you're doing different things, but your end result is economic mobility, as an example, and you have a different lever in the system of that economic mobility. When we all come together as a whole, then we can start to make some movement happen.
And it's interesting you said these organizations coming together is in and of itself systems change.
Mm-hmm.
Because systems usually reward one over the other.
Mm.
So do you as Sister of Charity look at potential grantees based on their willingness and ability to collaborate with others?
Certainly, yes. I think most funders do, but us in particular with the new focus areas that we've identified, it's been an interesting journey. We're only 5-ish months into this new strategy. We're barely into one funding cycle. So we're hearing a lot of questions and seeing a lot of maybe not really even sure what system they're in.
Mm-hmm.
What does their work do that's a lever for change? And we acknowledge that, and we're learning alongside people. But to answer your question, it is definitely not, at least in our funding now, in our work now, one organization that's delivering services is a part of something bigger.
Yeah.
And so our encouragement is to, if you're not already walking alongside in some way other organizations, whether it be for-profit, not-for-profit, grassroots, big, state, local, that you're all coming together to move change together. So I don't think that you can be a part of systems change and not be in collaboration, coalition, whatever word you want to choose, with others.
Foundation. We talked earlier about data, and you all value data so that you produced a poverty report. Again, measuring what you value, measuring the change you want to see. That is a powerful piece of work. What do you think they should surmise from this?
I want them to acknowledge that there are real people that are suffering in their hometowns, the people that they represent, the people that voted them into office in terms of the policymakers. And even some of our nonprofit and community practitioners, when you're in the business for a while, you get sometimes further away from the original why of why you chose to be in public service. Um, and so this most recent data, or hope, is that it would be that reminder of the why and get away from the business of what you do on a daily basis and making your decisions based on just that information, and to be reminded of why you ran for office. Why did you found this nonprofit? Why did you go into social work? Most of us do this because we wanted to help make the world a better place. Right. And when you read these stories, when I read these stories, and I would think most people who do sit down and actually read the full report, it's heavy. I could not read it all in one sitting. I was a part of, obviously, the interactions with the researchers and the team and bringing it all together, and I still had a hard time reading it in one sitting.
Was there a story that jumped out at you that sticks with you?
There were lots of stories. The theme, I would say, that stuck out with me was the heartbreaking theme is the shame that people feel, and the judgment that they perceive is coming their way. Again, I mentioned earlier that we don't think that poverty is a moral failing, but not everybody feels that way. And that was hard to hear, hard to read, that people are trying. And, list after list of, I made it this far, but then this happened. And I had this great network around me, and then one day I didn't. Born into a community that didn't value certain lived experiences, certain cultures, all of that, to me, that's what stuck out the most, is the mindset that both that what people of influence have, and the folks who we interviewed as identifying, as experiencing poverty.
It's your fault that you're poor, and not, like you said, recognizing that there are systems that have put people in poverty and keep people in poverty, because we have beautiful, talented people all over the state. Some of the most resourceful people are those that are in poverty. And there are so many lessons that can be learned from them. So with all of that information, what makes the current time right in South Carolina to explore this pursuit of systems change for poverty?
I think many would agree that the pandemic and the social unrest of 2020 were horrible, horrible times in our history. But I do think it shone a light on a lot of things for people who don't live and work in what we do every day, and it's not their reality, to see, people don't have health care. Why? Well, people are dying more over here. Why? And I know that was 6 years ago, and I know a lot has happened in the last 6 years, but I don't think that some of the momentum that we had from that time, I don't think it's all gone. I think that there's still ways that we can capitalize on some of those aha moments. It's no doubt divided more than it was in 2020. But hopefully people are getting tired of that division and starting to look more at the potential versus what's going to tear us apart. And I would also say, from a philanthropic organization's perspective, the groups that I get to be with and learn from throughout the country, in the Southeast and in our state, foundations are beginning to see themselves as voices in a way that they haven't before, and leaning into it, standing up for justice, standing up for the need for change. If the trend is moving toward that in other parts of the country, then we can give it a shot here in South Carolina, and hopefully others will join.
Well, I think that we call that advocacy, and it sounds like you, Sister Charity, and other philanthropic organizations are now prepared to lean in and advocate. What's motivating you to have the foundation move into that direction?
Yeah, thank goodness that others have already started this journey. Many foundations across the country have been doing this a whole lot longer, and they've been very generous with their time and their lessons learned with us as we're beginning to get in this space. To be advocates as a philanthropic organization is a privilege, and when you acknowledge that and know that no matter who sits in this seat, no matter who your program officer is at a foundation, they have inherent power, and newer ways of thinking in the philanthropic world, the sector. We've just got more people willing to not just write checks, and that's a cushy, easy job. I often have people say, "Gosh, it must be nice to give money away and not have to raise it." And yes, of course it is. But if you take it really seriously, that's just a small fraction of what you do in that advocacy, because when we go into a space and we're asking a policymaker to consider something or sharing information from their constituencies, we're not coming with our hand out. We're coming with just information that should help guide their decisions. And that does get the door open sometimes. And so if we've already got inherently that privilege of having a door opened more easily, let's use it. A lot of folks who are interested in getting into the advocacy as foundations, we're learning the what we can and what we can't do, what we should and shouldn't do, and making sure our boards are on the same page with us. And many community foundations and others, they've got a whole different host of issues that they have to think about. But there's still a lot of them that are putting themselves out there to raise the voices of their community.
You said it yourself. The foundation comes with a level of privilege, and you're willing to put that power and privilege to work to gain access. So with that access, how do you think philanthropy should play that role along with other partners to move the systems change dynamic forward?
We are one of the few foundations I know that we actually have someone on staff who's a director of community engagement. And that is on purpose, because we don't have the answers. The community does. So we take very seriously earning the trust of the community, and not abusing that power that we have. And if we happen to get a door open, not being the loudest person in that room once we get the door opened, that's really, really important to us, and that's not easy work. It would be easy to show up and say, "Hey, we're Sisters of Charity Foundation. We want you to listen to us. Here's the solution." But that's not us. That's not how we're doing it. And hopefully others aren't either, because that's just more of the same.
Right.
If you use your privilege and your power to get people to do what you want them to do, without having the people who are most affected in the conversation, I don't know that that's long-lasting change.
That's why the poverty study, having real life experiences as a part of it, I think is so powerful. How does the foundation build upon that? What do you see that as a way of moving the needle?
Part of what we have in our strategic plan and what will be a focus for us is acknowledging the capacity of these community leaders and the groups in community that we want legislators and we want decision makers to hear from. That's easy for us to say, right? Because we're not the ones doing the frontline work and keeping the lights on and trying to keep salaries paid. So we want to be able to hear from community leaders what capacity they need. They have the answers. They have the passion. Is it funding? Is it opening doors? Is it creating the convenings? What capacity do they need to lift their own voices?
Wow.
That not just let us open a door and walk away, and then you have the tools you need and the capacity you need to keep it going long after Donna Waits is gone.
Right. Now that to me is also systems change, because it's no longer where just the powerful and the purposeful that is able to make things happen, but you're empowering those voices to be able to advocate for themselves and to understand the systems so that they can be about the change themselves. I mean, this to me is monumental here for South Carolina. Now to have such a powerful organization, Sister Charity, with all of your notoriety and your credibility, to also be moving this work forward, it gives me hope in South Carolina that change can happen, even more than what we've been able to do over the last 30 years. What gives you hope?
The hope comes from their scrappiness, from their resiliency, from their humility. When that groundswell starts to happen, and I think it will, that's exciting. And if we can play a small role in however we can help make that groundswell happen, that's exciting.
I really want to thank you for today, but also thank you for your journey that led you to this work. I'm a man of faith, so I believe God orders all of our steps, and God has ordered you or placed you in this role for such a time as this. And you are uniquely gifted to be in this role at this time. If there's any inspirational message you would leave with folk who have the opportunity to experience this podcast, what would it be?
I want people to know their own power and to never lose sight of the people behind the work. No matter what work you're doing, there are people behind the work that are affected by your decisions. And no matter if you are a policymaker, a CDC, a grassroots leader, a funder, think about the possibilities and sometimes think about putting your own interests aside and think we want change to happen, but sometimes change will start right with us.
Right.
And no matter what role you play in this reduction of poverty effort, we can all learn from each other and stay grounded, stay open to change, open to new perspectives, open to new stories, and yeah, just swim all together in the same direction.
Thank you so much for today and for what you've done and what you're going to be doing in the future.
Thank you, Bernie. I am honored to be a part of this conversation with you and the work that we have ahead of us.
Awesome. Enjoy yourself.
The OpportunitySC podcast is a production of the South Carolina Association for Community Economic Development. Remember to like and subscribe for more episodes wherever you stream. Until next time, enjoy.